Hey guys, Don here. I want to talk today a little bit about not being just another podiatrist. There's a lot to do with what we do in terms of positioning ourselves. I a lot of times see patients that come in for a second opinion, and they may not remember the name of the other doctor. They may not know what was done, which isn't too uncommon, but the doctor didn't really make an impression. And the best place for us to make the best impression is either before the first visit or at our first visit. And I'm a big advocate of not really doing any treatment for orthopedic type of conditions like Achilles tendonitis or plantar fasciitis the first visit. I find sometimes we're in such a hurry to put that injection in them or do some type of a treatment right away without really developing the relationship. So let me propose some things you might want to consider. When you're seeing some patients in the office, let's say for plantar fasciitis, you do your presentation, you kind of talk about the different options, but I find it's much better, even before I start talking about me, I spend a little bit more time talking about them. Paul Hobro really just gave me some insight into this, as well as Dan Sullivan, his question. So when a patient comes in, I first of all ask him, how did you hear about us? And these days, pretty much everyone goes to Google, and that's how they hear about us. Even if they have a primary care that refers to us, they usually go to Google after they've been referred, or even prior. They don't even have to go see their primary care anymore. And once I get that, then I say, well, tell me kind of what's going on. And one of the nice questions I like to ask is, if we were meeting 3 months from now, what would make you happy with your progress regarding your health? And some of these things are obvious. I want my wart gone, I want my plantar fasciitis gone. But a lot of times when you're talking to them, and this is how I got into the aspect of helping patients, or at least giving suggestions to patients for weight loss, because I would say about 90% of my patients, they come in and they're exercising and they get plantar fasciitis, or they're trying to walk and they get plantar fasciitis, or something like that. And I was only able to help the plantar fasciitis, which I was good at. But how about the other aspect? How can we really serve them? And this is really a key. I know you might think, I'm not a diet doctor, no one's going to do what I tell them, things like that. But what I find is when you connect with the patients on a little bit deeper level of what's really important to them, or like what their real goals are, their goal probably isn't to get rid of their heel pain. Their goal is to exercise to lose weight, or their goal is to play with their grandchildren, or their goal is to do something else like that. And when you really have them talk and spend some time, especially on the first visit, just listening to them is key. It's so easy. We can come in pushing the bottom heel. It's plantar fasciitis or Achilles tendonitis or whatever it is, and you can just go through this is what you need to do, this, but it doesn't create any relationship, and anyone can do that. What really takes time is listening to them, and that might only be 2 minutes, 2 or 3 minutes, and you just listen to them, say, so what are your goals? Once you get rid of this heel pain, what are you wanting to do? What's the real reason? And then comes, the real thing that they want to do. And that might be losing weight. It might be something else like that. And that's where I found if I can help patients with other referral recommendations, it really sets you apart. I recently saw a patient. They were seen by a local orthopedist for Achilles tendonitis, and they came as a second opinion. And the orthopedist said, the patient asked for shoe recommendations, and they said, I don't do shoe recommendations. That's just not my thing. And they didn't give him any shoe recommendations. And I think as many things as I can give patients, as many recommendations I can give them that are good places to go to, it saves them a lot of time and a lot of money and a lot of frustration. And so the two most common things that I give my patients when they come in are a shoe recommendation, and it might only be a store, because a lot of these stores know what I want. So there's two locally, Sneakerama and Marathon Sports, that I send them to, and they'll either get like a Ultra or a Topo or a Hoka or some other type of shoe. And then the other referral place I give out all the time is physical therapy. And those are the two things, and they both are really good recommendations for these patients to get better. But beyond that, a lot of times these patients have other injuries, and they may need a really good massage place. You may have to have a chiropractor that you really believe in, or acupuncture, or a pain specialist for back pain, or any other type of specialist. Sometimes they might have a knee issue or a shoulder issue. So knowing these other people, that just can make things easier. I think giving good referrals is key. I was talking recently to you're going to laugh, I was talking to a dentist. And this dentist, the reason I was talking to him is because he does some type of like tongue tie work. And basically it's fascia, right? The tongue is connected all with the fascia. And he was doing these tongue releases, and people's foot pain were going away. Like they came in with like foot pain, and he did these tongue release procedures, or he did these type of appliances they put in the mouth, and it made their foot pain better. And all because of all the tension and all the fascia and everything else like that. And I was talking to him, and what he does is very similar. He sees someone, he's just not just a normal dentist, he sees all these kind of complex things, and he just listens, and he gives them the best people around as recommendations. So it's not just him, it's a team. So he might refer to like a physical therapy place, or like a movement specialist, or cranial sacral work, or other things like that. And once he finds really good people to refer to, it makes him look good, but it also helps the patient get better. Because many times we know it's not just an isolated, hey, you see me and I can do everything for you. It's not that way for what we do. They do need these other things. And if you have really good people, it makes you look good. So that's the thought. Don't just try to do everything yourself. Try to share. And when you share and find good people, you might not know who's good, but you start referring to them, and you're going to get feedback from your patients. And if you think about it, it's really the same thing that primary cares do. When they're referring to us, or other people are referring to us, they're going to get the feedback from the patient. And if that feedback is good, they're going to send more patients. If the feedback is bad, they're not going to send any patients. And the same thing, as we determine who we send people to and make recommendations, we want to get feedback from them to see how their experience is. And so when you have people coming to see you, you need to ask, hey, would you just let your primary care know you had a good experience here, or things like that. And so those are good things. Don't just kind of work in a bubble on your own. Try to get good referral sources. Okay? Once again, please register at Podiatry Practice Mastery. There are a lot of resources there to learn more. I'm starting to put my interviews on the same day I'm doing them, with all the kind of the raw footage. I'd like to know your feedback if you think that's helpful, and also what other things you'd like to learn about, we could talk about, or other people that might want to share some of your own success tips for your practice. I'd love to interview you, or even you just tell me them, and I'll tell the group. Okay, have a great day, guys.